Hi, I'm Dr. Shannon Bone with Advanced Rehab and Medical here in Jackson, Tennessee. Now I just want to spend a couple minutes today talking to you about a treatment option that we have called spinal decompression therapy. It's non-surgical spinal decompression therapy. And if you've suffered with neck or back pain or radicular pain, sciatica, or numbness and tingling in your leg or down your arm, we may have a solution that will work when nothing else has. So if you've been suffering with this and you've tried medication, you've possibly tried physical therapy, possibly tried chiropractic, acupuncture, spinal injections, it doesn't matter if all of those haven't worked for you. We've been using this technology since 2005, and we've literally treated thousands of patients using non-surgical spinal decompression therapy with great success. So there are studies that have been done, and we have seen that relevant to our practice that show an 85 to 90% success rate with these very, very difficult conditions. So in other words, that's a great chance that you can get better using this technology. So let me explain to you a little bit about how it works. When we're talking about a spinal disc, we have, here's a little model, and we have inside, it's like a jelly donut, okay? So inside we have the jelly, and the outside we have the donut part. So that's called the nucleus, and that's called the annulus. But I like to describe it to patients like a jelly donut. So if I set the jelly donut down and I push down on it, the jelly would move to one side, but not come outside of the donut. That would be what we call a bulge. If I push down hard enough on the jelly donut and the jelly pops outside, and we've all seen that, that would be a herniation. And then the herniation, the jelly could either break off and fall on the table, okay, and then it could stay inside. So that's called sequestered or non-sequestered. So all of those different conditions are relevant when we're treating that particular disc problem. The other condition that can happen is spinal degeneration or disc degeneration. Remember I said a herniated, bulge, or a degenerative disc. A degenerative disc looks like here would be normal, the space, and here would be where we're degenerated and don't have as much space. And see, that doesn't allow the same space for the nerves to come out of. The spinal cord runs inside the canal, and then we have these nerves that branch off each side, and those nerves run down in our legs or down into our arms and hands. So let me show you how spinal decompression therapy works. What happens with spinal decompression therapy is that we gently begin to pull those two bones apart, okay? And that's done over a series of treatments, and it creates a negative pressure inside the disc, and that negative pressure will cause the jelly to suck back inside. And the studies have actually been done where we did this under video fluoroscopy, which means that's a motion imaging where we put somebody on decompression and then we decompress their spine that had one of these conditions, and we could actually see that the nucleus sucked back inside of the disc. There's a very good chance you're going to be out of pain, and that allows the disc to heal so that it's not a chronic condition anymore, and we're able to do that without going under the knife. So if you've been suffering with one of these conditions, pick up the phone, give us a call, let us evaluate you to determine if you're a good candidate for this treatment, and then you can be on the road to success.